Tonight, an NBC Bay Area exclusive. Californians are paying billions of dollars for a new health care initiative to help our most vulnerable, people like seniors, the unhoused, and people with mental illness.
But in Contra Costa County, part of the program may be cutting corners and putting those patients more at risk. Tonight, a whistleblower comes forward speaking with investigative reporter Candice Nguyen.
This nurse doesn't want to reveal her identity because she says she's been retaliated against for trying to report concerns. Now only on NBC Bay Area, she's going public with strong allegations that Contra Costa Health denies that the system is ignoring medical needs, inflating caseloads, and harming patients.
It's been heartbreaking. It's been just really heartbreaking. Because we're supposed to be helping these patients.
This Contra Costa Health nurse says some of the county's most fragile and medically complex patients are being left in the lurch.
There are people who are unhoused. Some of them have been going to the hospital, ER, multiple times in a week. A patient who had a diabetic ulcer was given to non-medical staff, non-clinical staff. They then didn't address it. A full body infection happened. He needed to have his leg amputated.
It's not just this one case, and she says it's not the staffer's fault. Incidents like this, she says, occur regularly through Contra Costa Health's Enhanced Care Management, or ECM, benefit provided through California's new CalAIM program.
We're transforming Medi-Cal. It's our journey to a healthier California for all.
According to the Department of Healthcare Services, CalAIM's ECM benefit is supposed to address clinical and non-clinical needs, meaning both medical and social care assistance. But in Contra Costa, the nurse and 3 other sources familiar with the system tell us the program has abandoned medical assistance altogether. They say ECM case managers, who are nurses who were already with the system before the program started, are now being instructed to focus only on social needs, like a member's access to a shelter or fresh food, or their non-clinical staff, like housing specialists, who aren't trained to properly refer medical issues at all.
They've been told if they don't understand what a health condition is, they just should Google it.
That sounds potentially dangerous.
It's extremely dangerous. It's negligent.
Do you have firsthand knowledge of patients being harmed or dying as a result of this?
Yes. Yes, I do.
One fatal case she warned supervisors and county officials about through email last year involved a patient saying he couldn't get out of bed. A non-clinical staff member unknowingly labeled this patient as bedbound, and the rest of his care team treated him as such by only providing telephone visits. As a result, the patient didn't get out of bed for months, and his bed sores turned into bone infections. He later passed away, according to her email. Another ECM patient she emailed about received no discussion of health needs or health interventions for a year. When he was clearly sick, he was on death's doorstep, then passed away a month later.
I tried so hard to report this internally, and those concerns were both dismissed, and then I also received just the extreme hostility, abusive treatment.
We reached out to Contra Costa Health CEO Anna Roth. She declined our interview request. Instead, Kim McCarroll, their communications officer, spoke with us.
Are members' clinical care needs addressed?
So the way that our model is set up, no, except that ECM is a part of the entire care model.
But I was looking at the state's description of ECM, and it seems to be pretty clear. It says here, ECM is a comprehensive care management benefit to address both clinical and non-clinical needs for the highest needs members. So why isn't that happening in Contra Costa County?
Because we don't need to. So Contra Costa County is what we call an integrated system. So we have a whole clinical arm, and we have a whole ECM arm. And so we don't need to have our ECM program provide clinical care because our clinic system does that.
But it doesn't always, and cases fall through the cracks. That's what the Department of Healthcare Services found in a 2023 audit of Contra Costa Health after receiving anonymous complaints. The state found patients complained about not receiving enhanced care management services. In one case, a comprehensive history and physical examination wasn't completed, and without proper assessments, the state said patients may not receive important behavioral and medical health screenings that can help identify and prevent illnesses.
Does the state know that Contra Costa County is not providing clinical care through its ECM programs?
Yes.
When we reached out to the state, a spokesperson repeated in an email, both clinical and non-clinical needs must be addressed by ECM teams. There are a lot of taxpayer dollars involved. Contra Costa Health took in nearly $3 billion in Medi-Cal revenue in 2022 and 2023. Of that, it spent $56 million on ECM, according to the state.
I think that it's wrong.
This nurse says she's concerned cutting corners on medical allows the system to report more patients to the state to get more funding.
It gives them an excuse to really inflate caseload sizes, and because by ignoring clinical needs, it's totally manageable to manage just the social needs of 100 patients.
Contra Costa Health denies that serving more Medi-Cal ECM members means more money for the system.
The state actually determines the formula upon which we get paid. So having more of them is not a financial benefit to us.
We checked what other health systems are doing. LA Care Plan and San Francisco Health Plan tell us their ECM benefits address clinical and non-clinical care. But in Alameda County, Alameda Alliance's program appears to be similar to Contra Costa's, although we haven't heard of any issues there. Currently, Contra Costa Health says it's working to correct the problems detailed in the audit. With the investigative unit, I'm Candice Nguyen, NBC Bay Area News.
Candice, thank you. And if you have a story for our investigative unit, you can call 888-996-TIPS, or you can visit our website, nbcbayarea.com/investigations.